Just before we begin, I just wanted to share some upcoming webinars that we're going to have with the Center for Occupational and Environmental Health. On May 13th, we have an industrial hygiene webinar entitled The Impact of Line Speed on Worker Exposure to Parasitic Acid in Poultry and Swine Processing. And that's going to be with Dr. Jenny Leigh Holroyd. The week after, on Tuesday, May 20th, we have Beyond the Call, Industrial Hygiene Strategies to Protect Emergency Responders with Dr. William A. Jetter and the University of Cincinnati Education and Research Center. The next day, we have an ergonomics webinar that's going to be bilateral assistance from active knee exoskeletons to reduce the difficulty of occupational lifting and lowering tasks, with Grace Hunt at the Rocky Mountain Center for Occupational and Environmental Health. We also have some more webinars coming up. You can always find out about those at this link, www.coeh.berkeley.edu/webinars. So for today's webinar, I just wanted to welcome everybody on behalf of education and research centers throughout the country. We are pleased to present our webinar series, our OEHS webinar series. This collaborative effort on behalf of each ERC's continuing education program aspires to provide access to current research supported through NIOSH ERC programs. Thank you so much for joining us today. Today's webinar, An Occupational Safety and Health Approach to Injuries Caused by Student Behaviors, is presented by Dr. Monique Hossain, Dr. Robin Randall, and Robert Ibarra in collaboration with COEH and the Labor Occupational Health Program at UC Berkeley. Just a few housekeeping items. You will be muted during this presentation. If you would like to ask a question, please enter it into the online Q&A box at the bottom of your Zoom screen. We'll be able to save about 15 minutes at the end of the presentation to address as many questions as possible. We'll also have the chat open and feel free to use it to participate and join the conversation. This presentation is also going to be recorded and will be made available on the COEH website, or rather YouTube page, within 5 business days. All participants who logged in with their registration email for the full live presentation today will receive an email tomorrow with a link to an evaluation form that will qualify participants for a certificate of completion worth 1 continuing education contact hour. Once the evaluation is completed, you'll be able to access and print your certificate. So now I'm pleased to welcome our moderator, Dr. Monique Hossain. Monique is a coordinator of public programs at the Labor Occupational Health Program. Her project portfolio includes leading the WASHTEP, Worker Occupational Safety and Health Training and Education Program, and the School Action for Safety and Health Program. A UC Berkeley alum, Monique is a graduate of the Doctor of Public Health Program at UC Berkeley School of Public Health and Master of Public Health Program in Community Health Education at San Francisco State University. Monique brings extensive experience in program management, health education, and cross-sector collaborations in the areas of HIV and AIDS, youth development, sexual and reproductive health, and she has a background in mixed methods research through the lens of health equity, the intersection of race and gender, and cultural humility. Monique, feel free to take it away. Thank you. I'll stop sharing my screen. There we go.
Thank you so much, Will, and welcome everyone to this SASH webinar. We're so pleased you could be here to join Mr. Robert Ibarra and Dr. Robin Randall, our 2 wonderful expert panelists in this topic. I'm going to give you a little overview of what's happening. I'm going to start with a little reintroduction or introduction of LOHP and the SASH program. There'll be lots of program promotions sprinkled throughout. You'll see that. I'll offer a little bit of context for the topic and the issue to give a very brief overview of some components of an occupational safety and health approach. And then I'll turn things over to our wonderful panelists. And we will have time, as Will said, we'll have time for questions and answers. Please use the Q&A for that. And by the way, please send us reactions. Those are helpful. And let me get started. Thank you so much for being here. Thanks for joining us today. All right, I'll be sharing my screen to share some slides very briefly. As Will may have mentioned, I also want to mention more about this collaboration. This presentation by LOHP in collaboration with COEH, a Center for Occupational Environment Health, is based on the School Action for Safety and Health, SASH program administered by the Commission on Health and Safety and Workers' Compensation from the California Department of Industrial Relations. They have an agency agreement with the Labor Occupational Health Program at the University of California, Berkeley. And I should let you know, we also have partners that cover SoCal at LOSH, which is the Labor Occupational Safety and Health Program at UCLA. Just a reminder, we're LOHP. We do a lot of different things from policy analysis to research to training for action that involves employer and employee training and worker leadership development. We also do things such as campaigns, materials for campaigns like the heat, rest, shade, and water promotion for indoor heat. A little bit about SASH. The whole point of SASH is to reduce injuries and illnesses among school-based employees. We've been doing that since 2010. And the point is to reduce the high rate of work-related injuries and illnesses among school employees. School employees have consistently had a much higher rate of injuries and illnesses compared to the California worker population at large. It has gone down a bit, but there continues to be a gap. The other point of this program is to help school districts and such entities comply with Cal OSHA's Injury and Illness Prevention Program, which is the foundational standard for occupational safety and health in California. Just a little bit more about SASH. Again, it's a School Action for Safety and Health program, and it comprises training, the SASH Injury and Illness Prevention Program training, the IIPP training. It also involves occupation-specific workshops, and I'll be promoting a particular one on this topic of injuries from student behaviors. We offer webinars. I'll tell you a little bit about that. And of course, we are a resource center offering fact sheets and tip sheets, which are available online, as well as we have actual hard copies for folks who need those and they're not online in the course of their work at school. Just showing off a little bit, SASH has trained over 22,000 SASH coordinators across 44 of California's 58 counties. So if you're in a county that hasn't been touched by SASH, do call us. We would like to get that up to 58. These webinars are available online. Again, we want to thank our NIOSH-funded partners, COEH. Here's some you can go back into the archives. You'll see a link for recorded webinars. This one was Keeping Cool at School, addressing indoor and outdoor heat standards to protect workers. So it addresses that new indoor heat standard. And back in July last year, we did What Does It Take to Prevent and Address Workplace Violence? Again, the SASH program offers an IIPP training. It is free. All our training programs are in fact free. Here's a flyer for it, and I'm going to pause here for a minute. If you would like, please take a picture of this QR code. It links to our registration information. And at this time, this will take you to an open enrollment online SASH IIPP course that's coming up in June, but at any time it will take you to the latest SASH class available. So I'll pause here for you to take a picture, and please feel free to reach out to me as well if you have any questions. And this is a workshop we'd like to promote. And in fact, you will see this slide again. We have a free 1.5-hour workshop on preventing injuries from student behaviors. This is different from the type of training if you're a paraeducator or special education teacher, which you may have had in some required training. This is following the outlines of the fact sheet, which you will, of the tip sheet, which you will have available before we sign off today. But that is a training that's available both here in Northern California by reaching out to Yassine Khan at LOHP or to John Salazar at UCLA with our partners Loesch. So a little bit, again, I promised I would offer a bit of context. The public health issue is injuries from student behaviors. So we know that paraeducators are more likely to be injured by aggressive student behavior in their first 3 years of employment. Those who work in special education are more likely to be physically assaulted than those who engage in standard classroom teaching. And in 2015, the incident rate for violent acts, which includes aggressive student behavior, was 5 times higher for teaching assistants than for teachers. And just a reminder, such incidents may or may not be related to violent intent. It's often related to externalized behavior, involuntary behavior, dysregulation, and similar issues. And I think we have heard anecdotally and in various data that some of these concerns have been aggravated by the stresses of the pandemic. So a little bit about what the elements of an occupational safety and health approach are. We have here the hierarchy of controls is a very important framework and graphic in occupational safety and health. And that is about how we approach things that may cause harm to workers, whether it's physical or psychological harm. How do we address those? How do we control those? So in our approach to understanding occupational safety and health, we want to have an understanding of underlying causes of illnesses and injuries, not just what the direct cause was, but keep asking ourselves why. If a pallet falls and hurts or kills a worker, which is something that happens, I am sorry to say, we want to keep asking why. Why? Not just the going past the direct cause. But we do want to identify and address direct causes of injuries and illnesses. And that's where we think about the hierarchy of controls. And there are multiple things involved, but one of the outcomes is taking collective action to improve workplace conditions, policies, practices, and some of the elements of that approach is making sure that we have the data in hand, that we gather the data, that we propose the most effective solutions. And we do know what the most effective solutions are. We use the framework of the hierarchy of controls to determine what are the most effective solutions. And it also relates to being persistent and effective communication. Here are a few highlights from the tip sheet, and we'll go into these more deeply as we go through this, our time together this afternoon. Complete the necessary training. I just want to say that this tip sheet is specifically directed to paraeducators, so it's from the paraeducator perspective. So each of these things can be flipped to what is the employer's legal responsibility, and that would be to provide the training and make sure it is available. But advocate for training teachers on working with paraeducators, advocate for policy, both state and federal, strategize to prevent and manage harmful behaviors, and we're going to hear and learn a little bit more about that. Report incidents right away, and that includes reports required by the state if any emergency interventions are used. And the last line in that is follow up with self-care. And you will have seen this graphic before. Just a reminder, we're very eager to make contacts with you, have you reach out to us. We want to get this workshop out there. Again, it's a free 1.5-hour workshop. It's on preventing injuries from student behaviors. It's based on that tip sheet, again, which will be provided toward the end of our time together. Please reach out to Yassine or John, depending on where you are, and we would love to see you in that workshop. The next thing we're going to do is I'm going to turn things over to our panelists. First, I would like to give you a little introduction. Dr. Robin Randall, thank you so much for joining us today. Dr. Randall received his MD and MPH degrees from Tulane University School of Medicine and Tulane School of Public Health. He completed his adult and child and adolescent psychiatry training at the University of California, San Francisco. He is board certified in general psychiatry and child and adolescent psychiatry by the American Board of Psychiatry and Neurology. He joined Edgewood Center for Children and Families in 1999 as Associate Medical Director, serving youth and their families in residential, school, and community-based settings. He has served as Medical Director of Edgewood since 2002. Dr. Randall has also served as Interim Division Chief of Child and Adolescent Psychiatry and Interim Program Training Director of the Child and Adolescent Psychiatry at UCSF. He is also a volunteer clinical faculty member at UCSF and site training director for the UCSF Child and Adolescent Psychiatry Training Program on Edgewood campus. Dr. Randall has also held several offices in local and statewide professional psychiatry organizations, including the Northern California Psychiatric Society, the Northern California Regional Organization of Child and Adolescent Psychiatry, and the California Academy of Child and Adolescent Psychiatry. We'll be looking at this issue on multiple levels today, and we're very pleased to have him join us to share his expertise. Our other panelist is Robert Ibarra, and I just want to thank a member of our SASH Advisory Board for introducing us. I couldn't be more pleased that he is here. He is a paraeducator 3, and you'll learn more about that, with the Ventura Unified School District, where he has served for over 10 years. Prior to his work in education, he held a position of supervisor with the Ventura Superior Court. Throughout his tenure at VUSD, Robert has dedicated his efforts to supporting students with extensive support needs, ESN. He has completed applied behavioral analysis, ABA training modules through the district and played a key role in the introduction of the paraeducator tier classification system at VUSD, which now includes tier 1, 2, and 3 roles. Robert is an active member of the district's special education, SPED collaboration team, and regularly serves on interview panels for new paraeducator candidates. In addition to his work within the school district, Robert serves as the vice president of the Ventura Education Support Professionals Association. I think might be the union with the coolest name. It's VESPA, and we will learn more about that from him as well. I will turn things over now to Dr. Randall, and just let me know when you'd like me to start sharing slides.
Thank you very much. I'm happy to be here. As Dr. Hussain said, I am affiliated with a nonprofit organization called Edgewood Center for Children and Families, where I have worked in many venues where the issue of responding to aggressive student behavior is quite an issue. And I'm happy to be here. I will say that as I was preparing to be on this panel, it made me hearken back to the times where I have actually where I've actually been assaulted by students, and so it very much is something that I would like to make sure that doesn't happen to people when it's avoidable. Could we go ahead and start with the slides? Okay, I think that's the end.
There we go.
Yeah, there we go. So we have a sort of a rather large audience, so I'm not going to make any assumptions about what people know and don't know. So hopefully for most of you, some of this will be a review. But I did want to start by Dr. Hussain spoke about the tip sheet that will be available, and so my comments are going to sort of follow the structure of the tip sheet, and it starts with preventing aggressive outbursts, and so that's our primary goal. We always want to maintain safety by preventing, or at least significantly decreasing the chances of an aggressive outburst. And so one of the things that I want to say is that sometimes it feels like things that happen with students can come out of nowhere. But in truth, most of the time there is something, there's signs that things are not going well. And there's something called the escalation cycle that is on the screen right now. And the escalation cycle is a way of thinking about behaviors and extreme behaviors and aggressive behaviors, and a way of trying to break down what actually happens so that you can better respond to it and understand what's going on. And so I just want to briefly go through the escalation cycle. And again, this is the escalation cycle of student behavior. It's other folks as well, but we're specifically talking about students at this point. It starts with the student being calm. I think, oh, there we go. It starts with this, with sort of the calm state. You can see off to the left on the arc there, and things are just going along as usual. And then there's a trigger usually of some sort, either external or internal, and we'll go over the triggers and potential triggers on the next slide. But then, after the trigger, there's signs of student agitation. And what that means is there might be some verbal outbursts, or there might be some signs of irritability. Either the student may show it in their actions, but then the agitation then intensifies and goes into what we call the acceleration phase. And that's where the student moves closer to crisis and is clearly not able to calm themselves down. And then after the acceleration phase, we get to what we call the peak phase. And the peak phase is where you get sort of the highest intensity and potentially most dangerous behaviors. And that is when the student may have actually sort of lost their ability to control their behavior in a meaningful way. And it's where I think probably most of the injuries that we're talking about happen. And then after the peak phase, there's a de-escalation and recovery phases. And those are the phases where the student's behavior becomes more under control, their own control, and that they are able to recover their composure. So I went into detail here because I do think that it's oftentimes helpful to understand this escalation cycle and understand that things just don't come out of nowhere. And that oftentimes there are ways to think about what are the triggers. If the student's already triggered, how do you help them manage their agitation? If they're accelerating and about to get to their peak, how can you help them get to a de-escalation sooner rather than later? And so I think that's why it's helpful to have this cycle in mind, and the idea that things don't just come out of nowhere most of the time. Next slide, please. So we talked about triggers, and so I wanted to just briefly touch on some potential triggers so you can have in mind kind of what sort of things to look out for. And so you want to identify triggers early, and by early, it's both early in the potential crisis situation, but also when a student's not in crisis. If you know, for instance, that they frequently come to school hungry, and that's a trigger for them, then maybe there's something that you can do about that. If they're hungry, you can ask them if they're hungry and get them a snack. But you want to identify triggers early. And so you can think of triggers both internal, things like hungry, tired, frustrated. A lot of times frustration is due to frustration with things outside of the classroom, or it may be due to frustration due to being academically challenged. And so a lot of times it's the work itself that can be frustrating for students. So, for example, you have somebody who has a difficulty reading, and the task at hand right now is to read. That frustration may be a trigger for them that can then lead to the rest of the escalation cycle. Then you can also have external triggers. The environment plays a large part in triggering students. So the student may be too hot, they may be too cold, loud noises, especially for some students, can be a huge trigger if they are particularly sensitive to loud noises. I know some students wind up wearing noise dampening headphones, but understanding those kinds of triggers for individual students can go a long way to dampening down and diminishing the potential for aggressive outbursts. And finally, the interpersonal. The student has a disagreement with a peer or with a teacher. And so the problem, may be between the student and someone else, and not necessarily internal to them, or an external environmental factor. Next slide, please. So one of the places as a paraeducator that you can sometimes find out about known triggers for students is through their IEPs, and through behavior plans. And so, when possible, I like to recommend that people take a look at students' information to find out kind of what's already in the behavior plan, what's already in the IEP, so that they understand for this particular student, these are the things that are known triggers. I also want to point out that that the IEPs and behavior plans need sort of constant attention and update. That a behavior plan done when somebody is 9 may not actually be all that useful for them when they're 11, or even when they're 10. So that the things that trigger change as students age and mature. And so being aware of kind of what the current needs of the student are, what the current triggers of the student are really important. And if they do not have, or you do not have access to behavior plans or IEPs, I think it calls for being inquisitive about what are the known triggers for a particular student. And sometimes parents will know, or the teachers will know. And so I think however you get the information, it's very helpful to know what the triggers are. Next slide, please. Okay, so I want to go over some possible, and I want to stress that this is not an exhaustive list of early interventions, but these are the kinds of things that you might use for de-escalation. So we talked about the escalation cycle. These are the kinds of things that you might use for de-escalation. So one big one is praising good behavior. I've oftentimes been in situations with kids, I could see that they had been triggered, and they are starting to do something, and they're starting to ramp up. And I will look for anything that they did right in that moment to praise them. And you can see their bodies relax. And so if it's as simple as you say, hey, could you step one step to the left, please? And they do it, even if they do it grimacing at you the whole way, I will say, oh, great, thank you very much. And that sort of disarms them a little bit, because they're usually not expecting praise in the middle of them getting upset. Another thing is to understand, and again, this can be very individual for different students, but the use of space. So some students really de-escalate with sort of if you get close proximity. Other students need you to give them space. But it's sort of understanding for that particular student what is their need at the time? Do they need you to step in a little closer because your physical presence is comforting, or they need you to step back because it's threatening? I think it's not 100%, but I think in general, younger children, younger students like the physical proximity more of the adults than older students. Again, not 100%, but it's the kind of thing that you want to be aware of. And then in general, being aware of nonverbal communication. What are they sending to you nonverbally? What are you sending back to them? How you respond to a student's escalation can really trigger things in one way or the other. So that brings me to my third point, which is stay calm and use a calm voice. And it's not always easy. Students, especially if they know you, can oftentimes figure out what your trigger points are. But it's really important that you understand that it's really to everybody's benefit if you can remain calm. And again, I'm not saying that it's an easy thing to do, but I'm saying that it's a very helpful thing to do. Using calm voice, using very relaxed posture, not crossing your arms over your chest, for instance, and looking very sternly, being very open. Now, if someone is escalating and you're afraid that they're going to become physically aggressive, you don't want to do all that right up close to them, but you can still remain calm and keep a sort of a neutral stance while trying to de-escalate the situation. And then finally, again, and this is not exhaustive, offer choices or alternatives, ways to respond. And so as you see the student becoming escalated, going through that acceleration phase, you may offer them some other thing to do, some fun thing that you know they like. And that will help them think about, well, maybe I could go color, or maybe I can go do something, maybe I can go take a walk, maybe I can go outside, maybe I can do something other than getting very upset. Uh, Next slide, please. And then going along, so the tip sheet then talks about being prepared for aggressive outbursts. And this is both sort of internally and externally. I think we've sort of covered a little bit about the internal. Stay calm, remain neutral, think about the students that are in your care ahead of time and try to know as much as possible about their triggers, et cetera. But then also there's the external, the environmental things. Simple things like if you know you have somebody who's going to throw a desk at you, see if you can secure the desks. And I know that's not always easy, but it's that kind of thinking that sometimes really does need to happen to prevent injury. There was at one point in my career in child psychiatry where whenever I bought a toy for my office, I imagined it being thrown at my head. And that was one of the reasons I decided whether or not it was coming into my office, because I thought, okay, if this comes at my head, do I actually want, is it going to hurt me? Another thing to do is work in teams, meaning if you start to see a student going into an escalation cycle, don't try to manage it alone. As I said, when I started thinking about this discussion, I started thinking about the times that I had been assaulted as my time as a child psychiatrist, and almost every time it was just the student and I. And so if possible in the classroom in a situation, try not to be alone and work in teams. Next, be mindful of your physical space and attire. Um, I I can't tell if you all can see me because of my view, but I'm wearing a tie today. I almost never wear a tie because early on in my career, I realized that it was just a big noose for 9-year-olds to hang me with. Um, and so just be aware of what it is that you're wearing to work and whether or not it's something that will potentially cause you harm. And the last point is use of protective equipment. And that sort of varies depending on what the students are. And I'm being told that I need to speed it up. Okay. Next slide. Working with others, I've sort of already touched on that. So that's under responding aggressive outbursts. Hands off when possible. Injuries happen when we have to put hands on. So if it's possible to do things like clear the room if needed, try to do that. The injuries that I have seen, the worst injuries I have seen is when we've had to go hands on. Understand what is allowed in your SALPA regarding physical interventions. I think that's very important. And finally, don't take it personally. Oftentimes the students that you're working with it is not about you. It is about them and their inability to control their behavior. And then finally, after aggressive outbursts, follow whatever reporting requirements there are. Debrief with the other staff involved in the incident. I think that's very important. And when you have a chance and when the child is calm, discuss with them what might help them in the future and other coping mechanisms. Okay, and I will turn it over, and my apologies for running a little long.
Thank you so much. That was very interesting. I learned a lot in that short time. And it's time to turn things over to Mr. Robert Ibarra. And thank you so much for being here.
Well, thank you. And I'm so happy to be here and be able to listen as well and learn a few things also. But yeah, everything that was covered was very true as to how things can happen. You know, one of the biggest things, like he says, most injuries do occur when things get physical. If you have to get into a hole to prevent the student from even hurting themselves. And that's always the last resort, because you want to try to de-escalate, and you do want to try to see what you can do to before it gets to that escalation point. And it can be kind of difficult. It's easier said than done, so it can be very difficult. And one of the biggest trainings that we have, which most of everybody most familiar with, is the NCPI, Nonviolent Crisis Intervention, that does give you some tools in how to recognize some possible escalation points and or triggers for the students. And those are the things that you have to look at, you know, be it maybe the student looking at another student, and you can say, hey, okay, he has angry eyes, or his facial expressions. You want to try to identify those when you already know the student, you've worked with them, and you know their behaviors. You can seek something that's kind of out of their realm of normalcy, if you will, and you can just go ahead and try to look around the room. What is it that he sees? What is it that student may do? If you, like an object, pick it up, throw it at somebody, or go and grab the student's hair, or grab your hair, or your article of clothing, just like the example of look out for what it is that you are wearing. Don't wear your tie. Don't wear big loop earrings. Put your hair up if needed, because those are the things that get you. When we were in during COVID, when we started going back and we had to wear masks, those are triggers to some of the students. They would just go up and grab your mask. You have to be able to understand how and what you can do. Even you can wear the shield, but those they didn't like it, they went and grabbed it. So you got to be aware of your proximity and your distance, especially for those that are more aggressive than some of the other students. And yeah, any questions or something that you see?
Yes, I did have some questions for you, Robert. Do you think that the data are accurate and how extensive this problem is?
Yeah, I think it is pretty accurate because it does happen more times than reported. Because sometimes a para would be injured or hurt, but they don't report it. They just feel, well, I'm okay. I'm fine right now. But then a day or two later, like they say, it comes, now you're gonna feel it. And now it hurts. And they they feel ashamed to report it. But you got to encourage them. And as the vice president of our union, something happens, I tell them, report it because it may come back and get you later. So just have a record of it and make a report. And sometimes reporting can be not as demanding. If something happens, a lot of times they just, well, did you report it? Did you write a report? No, why not? You need to report things, no matter how little it is, because when it's time to come around to the IEP, that can be interjected as to here's some behaviors, here's what we have noticed. And if there's any aggression, then they can address that in the IEP and have a behavioral plan addressing those behaviors.
And I have a question. What is union density among paraeducators?
We advise them to join the union, especially in the field that they're in, because of they could be accused, they could be liable for maybe an injury to the student. Parents will think, okay, what happened? And if they have a student who's nonverbal, they may kind of only say something, maybe the para's name comes out. Oh, they did it. And I've seen where they have been accused of hurting a student, maybe even touching them, in a, not sexually, but to the student, it was to them. And they, unions are there and we're able to assist them. And for the most part, a majority of in our local here, they count on the union. And the unions advocate also for them as far as even training, compensation, health benefits, things of that sort, contractual wise, because of the dangers that are involved in the position. So yeah, they look to us to advocate for them.
Yeah, thank you for that. Because Dr. Randall mentioned a couple of things I think that go to working conditions when talking about external triggers like temperature or the conditions of the classroom or the loud noise, etc. And also working in teams would go to issues such as sufficient staffing. And Dr. Randall, I have a question to you from the chat. I did answer some of it, which is that this webinar does focus on students, and because the focus of the SASH program is about school-based workers. But how generally applicable is that escalation cycle that you described? Are some of these principles more generally applicable, but beyond the school environment, beyond students? I'll ask both of you.
Absolutely. The escalation cycle is something you can see in humans. And so we're specifically talking about students. So I spoke about it in that way, but the escalation cycle is something you can see in coworkers. You can see, it's generally applicable to people.
Oh, thank you. Robert, anything you'd like to add to that? Also, someone asked me about an abbreviation you used. Did you use the abbreviation NC, or what was the?
Oh, NCPI, that is the nonviolent crisis intervention.
Okay.
And that's actually nationwide for de-escalation, how to physically restrain students. So how to identify the triggers before it escalates to the last resort of having to physically restrain.
Okay. And what do you think are some approaches to working conditions that would help reduce the risk of injuries arising from student behaviors?
I think one is training, proper
Mhm.
training that it seems sometimes lacking, but that always, because it gives you the tools that you can utilize, gives you gives you like a bag of tricks to be able to de-escalate and be able to deal with problematic students or behaviors, and staffing, being able to have the correct amount of staffing with you in the classroom, outside the classroom, and being able to have, for your own protection, the tools that you can utilize, maybe having a pad blocker. If you have a violent student that can constantly hits, you can have it with you. We've utilized those in our past. And just being able to have a administration and a special ed department that will be there for you when needed.
Thank you. And I'm going to ask each of you the same question was, what are some things that you've seen that have worked? Where have, or that have been most effective, or is there things that you've seen that you'd love to see implemented in all schools, in all settings?
Well, I think that, one of the things that I think is really important and is we were just talking about training. I think it's important that if at all possible, that the members of the team all have the same training, because there are different approaches, and I don't know that any one approach is particularly great or better than the other, but I think it's helpful if everybody's on the same page in terms of how they respond to these things. And so I think a conversation with your team members about what the expectations are, what their trainings are, and an understanding of how they approach these things is really important. Because as we've said, working together is really a huge part of this. And so knowing what the other people around you, what the adults around you know is very helpful.
Thank you.
Yeah,
Robert?
definitely. Yeah, definitely concur with that, because even with NCPI training, it'd be nice to have it on site with who you work with, everybody taking that same training, so everybody knows what to expect and what to do, because some are different, some things are left out of different training classes, but get that consistency. That's always very important. And being able to, as Dr. Randall mentioned, collaboration, understanding the IEPs of not just in your classroom, but in our situation, we have 3 classrooms with ESN students. So we want to be able to know those students. So again, somebody needs assistance, we can go and assist them and know those triggers and know those behaviors and what the behavior plan is for those other students. Keep yourself safe, and it keeps the student safe.
Thank you for that. Yeah, I noticed the need for training has come up. The need for staffing has come up. And I want to tell you, in our work in occupational safety and health, the issues of workload and sufficient staffing, it is an issue we find across industries. It does not matter if it's in agriculture, if it's in the academy, if it's in healthcare, if it's in warehousing. The issue of adequate staffing and workload comes up, and it ties into other issues like stress as a hazard and so on. Thank you so much. I don't have any other questions at this time. I don't think. I'm going to check with uh, our participants. Are there any questions out there? I think we've answered most of them. Will the training information on how to prevent injuries from student behavior so that we may sign up be sent out? Yes, indeed. We will definitely send that out. We are looking for folks who are interested in having us come to them to do that training. Okay, and yes, Will has provided the information on NCPI here. I just want to make sure we get to all your questions. Okay, is it strictly a classroom setting? Thank you, Matthew. Yes. And here's some other questions that came in through the chat. I'm going to make sure we've got. Okay, Will, have we got all the questions answered?
It looks like there's a couple in the Q&A that just came in the last minute
Oh,
or
okay,
two.
great. Here we go. Are there services for adult day programs? Dr. Reynolds, is that something you might know about?
I'm not exactly sure what that means. There definitely are adult day programs, and adult day programs, if the adult have potential for aggressive acts, I think a lot of what we've talked about would apply. But so I'm not exactly sure what the questioner is asking, but there definitely are adult day services. And they usually are called day treatment programs, is oftentimes a term that you can search for. So if you're looking for adult day services, and if it's an older adult, you might want to look for sort of care homes or that sort of thing that may also have adult programming.
Robert, let me ask you this. The NCPI training, is that focused strictly on schools or does it address other settings as well?
It can address other settings. Most of the ones that I attend that are given by our SALPA have all of our schools within our school district. And yeah, pretty much that's what it is. Counselors, anybody that works at that ESN population, those are usually their teachers, etc.
Okay, yes, I'm suspecting that this question is are there trainings, are there similar trainings available for staff at adult day programs? I have another question here. What do you see as the role of the school nurse in supporting staff who have been injured? Robert, you have any thoughts on that?
Yeah. We have nurses that are on our sites, and they are consistently understanding our students. They'll come out and give us specialized medical training for individual students that may need it, such as maybe a G-tube, a EpiPen, so we'll learn how to administer those. Lift, if they need to be lifted out of wheelchairs or onto maybe for toileting or any type of specialized healthcare, they will train us on the individual student.
Oh,
and
thank you.
they're very, very helpful.
And a friend of ours actually, Erin Tarkanian in the chat has mentioned that NCPI offers trainings for hospitals too. So I hope that is helpful. In terms of, we also have a question about developmental disabilities, adult programs. We do not provide those trainings specifically, but there are a lot of trainings available for healthcare settings. And the question from Scott is, does California have a standardized incident report form? Scott, I have to tell you, I would have to double check on that, but I'm not sure that that is the case. I think every employer has some kind of incident report form, and we help people, decide what those should look like. But I don't know that that is standardized. I'm sorry, I don't have an answer for you. That is that of which I can be completely sure.
Yeah, I can answer. We have ours through our
great.
SALPA. They
Okay.
give us for within their local.
Okay, and we have not a question, but I wanted to share a link to free resources created by our Health and Safety Association partner, PSHSA, dedicated to reducing violence in schools. And that link is in there. Trevor King from Ontario, Canada. I would be interested in how student behaviors correlate with workplace injuries. I work in dining services and employ 300 to 500 students per semester. Okay, thank you for that. Are there any other questions? We just have a few minutes left. And Will has shared that link in the chat that came into us from Trevor. Is there effective training and interventions being implemented in public education directly to the students to improve their own self-regulation and de-escalation? That is our last question that just came in.
I don't know of if there's sort of widespread. I think oftentimes with students, it really is individualized. And so you think that's why I sort of mentioned the IEP and behavioral plans, because you have to really look at the individual students' needs and what their understandings are and what their capacities are to actually control the behaviors. And it changes over time. And so I don't know of any kind of widespread large training directed at the students in that way. But in the sense that the IEP process and behavioral plans are supposed to support the student's behavior on an individual level, I think that's the route that takes.
Thank you. All right, I think we have covered these questions, and I want to thank each and every one of you. Right now, we have 145 participants online. We're so pleased that you're here. Please know that LOHP is here for you with other resources. We have numerous programs available. This is just one of them, which is very much centered on school-based workers. I want to thank Robert Ibarra for his sharing his expertise, his extensive experience in this arena. I want to thank Dr. Randall for joining us today and also giving us his perspective. And as promised, I have one last thing to do, which is I said that I would put the tip sheet in the chat for you. So I'm going to do that right now. And we'll be wrapped up for today. If you one moment, I'll get that in the chat. But and of course, I want to thank COEH for hosting this. And the tip sheet was something that was generated by LOHP and was done with NIOSH funding. I think it's rather important. Just any opportunity, I have to remind people what public infrastructure is and what it does and how important it is and how many lives it touched on and how it affects population health. I just want to mention that this is one of those things. This fact sheet was produced with NIOSH funding. Our webinar here today is because of the NIOSH funded Education and Resource Center, that is COEH. And I just want to appreciate everyone who helped us get this together today. Thank you so much for your time. Thanks for being here. And again, to our panelists, live applause emoji. Thank you so much.
Thank you, Monique. Hope
Thank you.
everybody has a great day. Thank you.
All right, thank you.